the specific stain. Now we will study blotting techniques. Blotting technique is a very easy topic. Technique. It's totally based on mnemonics. So try to understand. There are 4 types of blotting technique. There are 4 types. One is northern blotting, southern blotting, double T, western blotting, and the last one is eastern blotting. How to remember which molecule we use in which type of blotting? It's very simple. Okay. Northern blotting. In northern area, most of the people like to consume roti. R-O-T-I, roti, or fulka, we say in Punjabi, roti. R for RNA. In southern blotting, most of the South Indian people like to eat dosa. D-O-S-A. D for DNA. In western blotting, western culture, most of the people like to eat pizza. P for
pizza.
Protein. Eastern blotting, E for eastern, E for enzymes. So enzymes are which blotting technique we use for enzymes? That is eastern blotting. E for eastern. Eastern blotting is used for enzymes. So there are 4 types of blotting: northern blotting, southern blotting, western blotting, eastern blotting. For northern blotting, we use RNA is used for. In northern blotting, we used to blot RNA. Southern blotting, we used to blot DNA. Western blotting, we used to blot protein. And for eastern blotting, we used to blot enzymes. Now there is yet another simplified mnemonic. S-N-O-W. Snow. D-R-O-P. Instead of O, you can write it as E. So here, southern blotting DNA, northern blotting RNA, eastern blotting enzymes, western blotting proteins. Southern blotting used to blot DNA, and northern blotting is used to blot RNA. These are the mnemonics. You can note it down, or this is yet another simple mnemonics, new drip. Okay. So we are done with blotting techniques. We are done with stains. Now our next topic will be aging. Aging, umar ho jana, budhapa, aging. Aging. Okay, write down the definition of aging. It's a normal physiological process that occurs because of imbalance in insulin glucagon homeostasis. We can write it down. Is a normal physiological process that occurs due to first one, insulin glucagon homeostasis. Insulin glucagon homeostasis. Now write down one more thing in bold letters. What is citroins? What is citroins? R-U-I-N-S. Okay. What is citroins? What is citroins? Citroins is a protein that mediates aging. Citroin is a protein that mediates aging. Okay. So you can write like this: aging is mediated by citroin proteins, or citroin is a protein that mediates aging process. So 2 things you have to remember in aging. First one is it's a normal physiological process that occurs due to insulin glucagon homeostasis, and second thing, citroins is the protein that mediates aging process. Okay, write it down. Now next thing that I want to explain is how to prolong this process. Actually, it is not correct to say that how to prevent aging, because you cannot prevent aging. Rather, what you can do is you can prolong the aging process. So write down how aging process. I will write how, and I will explain each and every point. The first process is less eating or reduction of calories. Less eating or reduction of calories. Second one is intake of antioxidants. एंटीऑक्सीडेंट्स लेने से जवानी बरकरार रहती है. Okay, so how to prolong aging process? First one is less eating or reduction of calories. Second one is intake of oxidants, and third one, I think the third one every Indian knows, Ramdev Baba. Exercise. Baba is popular for exercise and yoga. So these are the three lifestyle changes you have to do to prolong aging. First one is eating or reduction of calories, intake of oxidants, and Ramdev Baba or exercise or yoga. There is one more process or one more thing that you can do to reduce your age. You will love to hear this option, that is intake of or consumption of REDWINE, red wines. Okay, there are four things: less eating or reduction of calories, this is a lifestyle changes, then intake of antioxidants, then Ramdev Baba or exercise and yoga, then intake or consumption of red wine. Red wine is good for heart and it is also good for liver. So if we will preserve our liver, like liver is an organ of detoxification, so it removes all the toxins from our body. Now if we will preserve our liver, if our liver will work better, then we can prolong our aging process. So intake or consumption of red wines can also prolong the aging process. Now we will see what are the changes during aging. Okay, these all changes you must be familiar with. So what are the changes due to aging? Due to aging. Okay, we will write one by one and I will explain each and every changes. Okay, first one is hardening of blood vessels. As the age increases, like ये बोल सकते हो कि बुढ़ापे में there is hardening of blood vessels, that is decrease in elasticity of the blood vessels. Okay, second one is less antioxidant production. This is the reason why we are taking antioxidants to prolong our age. So antioxidants हमको क्यों चाहिए? Because there is less antioxidant production, so we need antioxidants to prolong our aging. Now third one is more somatic mutation. More mutations in the body cells, this is known as more somatic mutations. Now fourth one is more free radical injury. More free radical injury also occurs in the process of aging. Now fifth one, everybody has seen in their grandpa and grandmas, wrinkle formation. Wrinkle formation in Hindi is also known as jhurriyan. Then sixth one is aggregation or accumulation of fat, पेट में या फिर in our belly region, abdominal region or in the hip region, there is accumulation. Fat starts accumulation or aggregation. This is also a sign of aging. Next one is seventh one is graying of hairs. You can't say that hair becomes white after aging. You should say, it's better to say that graying of hairs in the head region and the beard region, this is a sign of aging, or these are the changes due to aging. Now one more thing, you all will agree with this. Some people look more older than their age. Actually, it may be congenital or it may be acquired. Acquired in the sense that due to your malpractices in day-to-day life, eating more of junk food and eating less of salads and eating consumption of more of alcohol, then the aging process will be provoked and aging process will be faster. So some people look much more older than their age. This is the acquired process, that is our mal habits. Or generally there is a congenital condition also, that is known as Werner's syndrome. Werner syndrome जिसको याद नहीं रहता वो याद रखेगा पा. Pa movie everybody has seen. Amitabh Bachchan is looking much more elder than his age. It's also known as progeria. Progeria is premature aging. समय से पहले बुढ़ापा, that is premature aging or Werner syndrome or progeria, as you have seen in Pa. So you should note it down. Changes due to aging: hardening of blood vessel, less antioxidant production, more chromatic mutation, more free radical injury, wrinkle formation, aggregation and accumulation of fat, graying of hair. Some people look much more older than their normal age. This is known as Werner syndrome or progeria or Pa. Now we will study one more topic that is also important and more of mugging up like thing, that is intracellular accumulation. Okay, what is intracellular accumulation? Accumulation of things like protein, lipid, calcium or any pigment is known as intracellular accumulation. So you can write it down, the definition: accumulation of things like protein, lipid, calcium and other pigments is known as intracellular accumulation. Okay, now we will step by step read. I will write down step by step accumulation of what causes what. First, accumulation of protein is seen in anybody? Alzheimer's disease. Okay, if anybody can explain me, where did I talk about this disease previously?
Shrinking of the brain.
Yes, Alzheimer's disease is also seen in Alzheimer's disease. The clinical presentation is shrinking of the brain,
Atrophy of the brain.
atrophy of the brain. That is a classical example of hypertrophy. So I have given the example of Alzheimer's disease in hypertrophy, that is atrophy of the brain or cerebral mass. So Alzheimer's disease is due to accumulation of proteins. Now the next thing is, this is protein. This is normal protein. Normal protein accumulation in Alzheimer's disease. Try to understand infected proteins. Those proteins that are infected. Infected proteins are known as prions. Accumulation of prions are seen in Creutzfeldt-Jakob's disease. Accumulation of infected protein are seen in Creutzfeldt-Jakob's disease. So two things, just I will repeat so that you can remember. Accumulation of protein. Accumulation of protein is Alzheimer's disease. Accumulation of infected protein or prions is Creutzfeldt-Jakob's disease. Okay, the third one, actually pathology is more of bodies, what you see microscopically, because generally pathology, what we see is that like after death, during post-mortem, we take the specimen of different tissues, different cells from different organs, and then in microscope we used to we always used to see the pathology of the death, why the death occurred. Now the third one, just write it in bold letters, LEWY, bodies, Lewy bodies. Accumulation of Lewy bodies is seen in anybody? Parkinson disease. Okay. Okay, one general question to everyone in the class. If you know, it's a general question. Parkinson disease occurs due to deficiency of which neurotransmitter?
45.
No. Anybody else? Parkinson disease is occurred due to deficiency of which neurotransmitter? It's very simple question.
CFT.
No, it's cystic fibrosis. It's dopamine. Dopamine is the neurotransmitter. Deficiency of dopamine causes Parkinson disease. So Lewy bodies are seen in Parkinson disease. Prions or infected proteins are seen in anybody? I've written here Creutzfeldt-Jakob's disease. Accumulation of normal protein is Alzheimer's disease. Okay, next topic, fat deposition.
Alzheimer's disease.
Okay, fat deposition. Fat deposition, very first one is atherosclerosis. Atherosclerosis. Okay, I will give you a general brief concept about atherosclerosis. In atherosclerosis, there is a formation of atherosclerotic plaque. In that plaque, generally what is present? Macrophages along with LDL. That is, what is LDL? Low density lipoproteins. Okay, there is accumulation and they form a plaque, that is atherosclerotic plaque. So fat deposition is seen in atherosclerosis. Where the atherosclerosis occurs generally in blood vessel. In blood vessel we have three layers. 1, 2, 3. Anybody? Tunica intima, tunica adventitia, tunica media. In atherosclerosis, atherosclerotic plaque is formed in tunica intima. So plaque is formed in tunica intima. More fans. Then next one is hepatic steatosis.
Fatty liver.
Hepatic steatosis. What is hepatic steatosis? In other words, you can say fatty liver. Okay. You know, most of you who are who is watching this video must not be knowing that he or she is suffering from hepatic steatosis. Hepatic steatosis is a very general condition nowadays. It's fatty liver. Okay. Now, how to understand hepatic steatosis? It is generally due to two reasons. One is alcoholic hepatic steatosis, that is due to alcohol. We will study it in liver pathology. One is junk food, non-alcoholic hepatic steatosis. Non-alcoholic hepatic steatosis is due to consumption of more junk food like Chinese, German, these all things. Now, hepatic steatosis, fatty liver. How can you detect that I am suffering from fatty liver or hepatic steatosis? Is very simple. Like after defecation, you will see that your stool is sticking in the pan. Stool sticking in the pan is a classical symptom of hepatic steatosis. What it? You can even write it. Stool sticking in. अगर पानी डालने के बाद भी ब्रश मारना पड़े इसका मतलब हेपेटिक स्टीरोसिस है. The next one is, we are done with fat deposition. Now pigment deposition. There are many pigments, melanin, then we have urochrome, lipofuscin. So like pigment deposition. Pigment deposition. Okay. The first pigment that we will talk is bilirubin. Bilirubin is generally accumulation of bilirubin is known as jaundice. Very simple. It imparts a yellow coloration in the body, nails, and also in the urine. So excess of bilirubin is known as jaundice. So first of all, write jaundice. If this bilirubin excess of accumulation is in eye, it is icterus. If it is in brain, anybody? Carnicterus. Write it down. Bilirubin accumulation is known as jaundice. If it is in eye, it is icterus. If it is in brain, it is carnicterus. The second pigment that we'll talk about is melanin. Write down melanin. Melanin. Excess accumulation of melanin in the body is known as hypermelanosis. Hypermelanosis. Just write it down. That's enough to know about melanin. Hyperaccumulation is known as melanosis. Now the next pigment that we will talk about is lipofuscin or urochrome. Lipofuscin or urochrome. Very important. Okay, the next pigment that we are talking about is lipofuscin or urochrome. Lipofuscin is also known as urochrome. Now this is also known as, write in bold letters, wear and tear pigment. This is also known as lipofuscin. Lipofuscin is also known as wear and tear pigment. Now, because of lipofuscin, there is brown atrophy, underline brown atrophy of organs due to aging. This all accumulation of these all pigments is is an indication of aging. So brown atrophy of organs is due to lipofuscin. Now it causes brown atrophy of organ. I already told you. Now if this lipofuscin, I already told you this is a weird treatment. This is brown. It causes brown atrophy of the organ. Now it is also present in cachexia. What is cachexia? Already told you, in the terminal stage of cancer there is loss of appetite, loss of weight, loss of muscles, atrophy of muscles. This is characterized by cachexia, that is terminal stage of cancer, and in cachexia you will see lipofuscin deposition or urochrome deposition. Now the last pigment that you are going to study is, no, not the last, the second last pigment, hemosiderin. In the name itself you must be knowing hemosiderin is there from iron. Hemosiderin, from name itself you should guess that this pigment is there from iron. It is, you can write what is hemosiderin. It is a precipitated form of iron and its deposition in excess is known as hemosiderosis. So two terms, hemosiderin and hemosiderosis. What is hemosiderosis? Accumulation of, anybody? Accumulation of hemosiderin is known as hemosiderosis. समझा बाबा? Accumulation of hemosiderin is known as hemosiderosis. Hemosiderin क्या होता है? Hemosiderin is a pigment that is precipitated form of iron. हो गया? अब हम पढ़ेंगे दो चीज. एक होता है हेमोसिडेरोसिस और एक होता है हीमोक्रोमैटोसिस. तो बेसलाइन डिफरेंस क्या है वो समझ जाओ, बाकी हो जाएगा. What is the baseline difference between hemosiderosis and hemochromatosis? In hemosiderosis there is also, देखो मैं लिखता हूँ, there is hemosiderin accumulation present. Here also present. No, ये बड़े बड़े अक्षरों में लिखना. No tissue damage. Here tissue damage present. That's the only difference between hemosiderosis and chromatosis. In both, hemosiderin accumulation is occurring, and one is no tissue damage, and another one is there is tissue damage. Now there is no tissue damage. It's not pathological. You just know this condition is due to accumulation of hemosiderin. So we will discuss details of hemochromatosis. So write it down, heading hemochromatosis. Very simple, very short topic. Finish it faster. What is hemochromatosis? Anybody?
Excess hemosiderin secretion.
Accumulation of hemosiderin causes hemochromatosis with tissue damage. There is presence of tissue damage. Okay. Or you can write that accumulation of hemosiderin in visceral organs like liver, skin, pancreas and other organs causing tissue damage or organ damage is hemochromatosis. Okay, the first organ,
Liver.
Second,
Skin.
third,
Pancreas.
We will see.
Another visual organs.
Pancreas. Okay, we will sequentially see what will happen if the hemosiderin is deposited in liver, then after in skin, and if it is present in pancreas. Very simple. If there is excess of hemosiderin in liver, if there is excess of hemosiderin accumulation in liver, it will cause liver cirrhosis. Liver cirrhosis is a fatal condition. In liver cirrhosis, what will happen? There will be death of hepatocytes.
Yes.
Oh, I forgot to tell you, in acute hepatitis also there will be death of hepatocytes. In acute hepatitis also there will be death of hepatocytes, and this is an example of anybody? Pathological apoptosis. In pathological apoptosis, I told you about acute viral hepatitis. I forgot to tell you that in acute viral hepatitis we will see Councilman bodies. That is, acute viral hepatitis. So that is acute viral hepatitis. There will be also death of hepatocytes due to viral infection. What we will see, there will be death of hepatocytes. So these hepatocytes will make colonies, and this is known as Councilman bodies. So Councilman bodies are seen in acute viral hepatitis. Hemochromatosis, it is accumulation of hemosiderin and causing organ damage or tissue damage or cell damage. Okay, if hemochromatosis, we will study that there is deposition of iron in different organs. So first organ is liver. If hemosiderin will accumulate in liver, it will cause liver cirrhosis. If it will accumulate in skin, it will cause, I will explain this process like, you know, जो लोहे की चीज होती है उस पर जब जंग लग जाता है, there will be bronzing. So in skin also there is accumulation of hemosiderin, it will cause bronzing of skin. Okay, there is a very interesting phenomena happening in the pancreas. What will happen in the pancreas? In pancreas we have alpha, beta, gamma and delta.
Yes.
Now alpha secretes glucagon. Beta secretes insulin. Now what will happen is, this hemosiderin will accumulate on beta cells of pancreas. Now if beta cell, if it accumulates on beta cell, then it will affect the function of beta cell. What is function of beta cell? It secretes insulin. There will be low production of insulin. Low production of insulin is also known as hypoglycemia. Hypoglycemia, and this condition is known as DM, diabetes mellitus. So, or this condition is simply known as diabetes. Diabetes. So, hemochromatosis is also known as, write down, it's important. Hemochromatosis is also known as, AKA means also known as bronzing diabetes. Bronzing diabetes because the skin in hemochromatosis, diabetes occurred due to hemochromatosis, the skin color will be bronzing skin. So the hemochromatosis is also known as bronzing diabetes. Okay, further we will study. Hemochromatosis is over. It is also known as bronzing diabetes. Just remember this one. Okay. Okay. Last thing that I forgot to tell you, that accumulation of causes of hemochromatosis. Causes of hemochromatosis. First one. Okay. How can I explain? Okay, you have to mug up this thing. What is the cause of hemochromatosis? First of all, the basic. What is the basic of hemochromatosis? There is accumulation of hemosiderin. So how the accumulation of hemosiderin will increase? If there is more iron in our body, so how excess iron will be present in our body if we take more of iron pills? So excess intake of iron pill, not prescribed by doctor, and you are taking excess iron pill, it can cause hemochromatosis. Second, IV iron. Someone is taking iron in IV route, then also. Third one is MBT, that is massive blood transfusion. Okay, what are the causes of hemochromatosis? First is iron, if you are taking excess of iron pills. Then second one is IV iron, and IV iron, that is intravenous iron. Or third one is massive blood transfusion. This is okay. These three causes are due to our bad habits or our mal-habitual. This is due to our fault. We are taking more iron, so we are taking more iron in IV, or it is due to massive blood transfusion. So it is due to our error or our habitual error. So these are acquired. There is one genetic cause of hemochromatosis also. Okay, what is the genetic cause of hemochromatosis? That is mutation of HFE gene. Just write down mutation of HFE gene. So excess of hemosiderin or excess of iron pigment in body is known as hemochromatosis. The accumulation of hemosiderin in different organs causing organ damage is hemochromatosis. The causes of hemochromatosis are iron, excess intake of iron, IV iron, MTB, that is massive blood transfusion. But these are the acquired causes. What is the genetic cause? Mutation of HFE gene. Okay, now the treatment. We studied what is it, then the causes, now the treatment. So the treatment is very easy. As you know, this is due to accumulation of iron. So what we will take? Chelating agent of iron. Chelating agent means those substances that will absorb the iron from different sides and take it out from the body. So iron chelating agent is okay. Anybody who knows iron chelating agent?
Desproxamine.
Desproxamine. Perfect. Pyroxamine. So the treatment will be iron chelating agent, that is desproxamine. So causes you know now. Causes there are two acquired and genetic. Now treatment is iron chelating agent, that is desproxamine. So desproxamine is iron chelating agent. You should remember iron chelating agent is desproxamine. Suppose there is toxication of any of the metals, suppose copper, then we will take chelating agent of the copper. Chelating agent of copper is, which is the chelating agent of copper? That is D-penicillamine. Okay, that's the end. Now we will move on to our last accumulation, that is calcium accumulation. Last in the fluid accumulation. Okay, write down the definition. Accumulation of calcium is known as calcification. Accumulation of calcium is known as calcification. There are two types of calcification. Write it down. Very simple. One is dystrophic calcification. One is metastatic. Okay. Calcium accumulation is known as calcification. One is dystrophic calcification, one is metastatic calcification. Just I will tell you the differences between dystrophic calcification and metastatic calcification. Very simple. See, it's D found in dead tissue, found in live tissue. Right? Very simple. Dystrophic calcification is found in dead tissue and metastatic is found in live tissue. It is live tissue, so the serum calcium will increase. Calcium will increase. Here it is just dead tissue, so the serum calcium will be normal. Sorry, it's normal. These are the two main differences. What is in dystrophic calcification? It will be occur in dead tissue, D for D. In metastatic calcification, it is due to live tissue. And serum calcium is normal in dystrophic calcification, whereas in metastatic calcification, the serum calcium will increase. Okay. Now I will tell you the diseases in which you will find dystrophic calcification and the diseases. If you remember one, then you don't need to remember another one. So I will tell you the diseases in which you will see dystrophic calcification. Okay. Dystrophic calcification is seen in. Okay, first of all I will write down the mnemonic. And then I will encode the mnemonics. It will be better. Okay.
Most PG.
रात में पढ़ते हैं पीजी के स्टूडेंट. रात most PG double M 2 into M. Okay. Any one of you who can encode all these mnemonics?
Yeah. R for rheumatic fever.
Okay, Panda. One by one. R for
Rheumatic heart disease.
rheumatic
Heart disease.
heart disease. Rheumatic heart disease, the acute condition in first rheumatic fever will occur, then rheumatic heart disease. So rheumatic heart disease. Okay, H-A-R-T, heart disease. Then A for atherosclerosis. मतलब कि atherosclerosis में हमने कहाँ पर पढ़ा था? फैट. जब हमने पढ़ा था फैट डिपोजिशन, उसमें भी पढ़ा था atherosclerosis में भी पढ़ा. मतलब कि फैट डिपोजिशन में भी atherosclerosis होता है. इसमें इंट्रासेलुलर कैल्शियम कैल्सिफिकेशन, सॉरी कैल्सिफिकेशन, दैट इज डिस्ट्रोफिक कैल्सिफिकेशन में भी atherosclerosis होता है. atherosclerosis. T for
Tuberculosis of lymph node.
दिस इज वेरी स्पेसिफिक, इसको बोल्ड लेटर्स में लिखो। अगर कहीं का भी टीबी बोले, एक्स्ट्रा पल्मोनरी टीबी बोले, कहीं का भी टीबी अगर बताया गया है, देन इट विल बी डिस्ट्रोफिक, इट विल नॉट बी डिस्ट्रोफिक calcification, it will be metastatic calcification. If it is mentioned that tuberculosis of lymph nodes, it will be dystrophic calcification. Then is 2M. प्रत्युष, M by M बता। फर्स्ट M क्या है?
मेनिंजियोमा।
मेनिनजियोमा। दूसरा वाला M क्या है?
मेसोथेलियोमा।
मेसोथेलियोमा क्या होता है?
प्लूरल कैविटी कैंसर।
हाँ, परफेक्ट। मेसोथेलियोमा इज प्लूरल कैविटी कैंसर। ओके। वो क्या होता है?
ओवारी पैपिलोमा।
ओवारी
पैपिलरी।
पैपिलरी कैंसर ऑफ ओवरी, ठीक है?
ओके।
पैपिलरी कैंसर ऑफ ओवरी। व्हाट इज एस?
सैलिवरी ग्लैंड।
पैपिलरी कैंसर ऑफ सैलिवरी ग्लैंड, ये है ना?
यस।
ठीक है।
Papillary cancer of thyroid.
पैपिलरी कैंसर ऑफ थायराइड। चलो प्रफुल्ल, पी हो गया। हाँ, पी क्या है? प्रोलैक्टियोमा। वरना प्रोलैक्टियोमा क्या होता है?
Anterior pituitary tumor.
एंटीरियर पिट्यूटरी कैंसर और ट्यूमर। ओके, एंटीरियर पिट्यूटरी। ओके। जी क्या होता है? ग्लूकागोनोमा।
Alpha cell.
ग्लूकागोनोमा। ओके। आर फॉर, मेरे साथ रिपीट करो। आर फॉर
Rheumatic heart disease.
ए फॉर
Atherosclerosis.
टी फॉर
Thyroid.
ट्यूबरकुलोसिस ऑफ लिम्फ नोड। एम, दो एम है। पहला एम फॉर
Meningioma.
दूसरा एम
Mesothelioma.
ये याद रखना कि पहले मेनिंजियोमा, उसके बाद मेसोथेलियोमा, वरना निमोनिक गलत हो जाएगा, बिकॉज इसके बाद मैं बहुत इंपॉर्टेंट चीज बताने वाला हूँ। सो फर्स्ट एम इज फॉर मेनिंजियोमा, सेकंड एम इज फॉर मेसोथेलियोमा। मेसोथेलियोमा इज द कैंसर ऑफ प्लूरल कैविटी। नाउ ओ फॉर
Papillary cancer.
पैपिलरी कैंसर ऑफ ओवरी। एस फॉर
Papillary cancer of salivary.
टी फॉर
Papillary cancer of thyroid.
देन पी फॉर
प्रोलैक्टियोमा।
प्रोलैक्टियोमा। जी फॉर
लुकानोमा।
बस एक चीज याद रखना, जो मोस्ट लिखा है ना, द मोस्ट, एमएसटी, नीचे वाले एम को मिला के, मेसोथेलियोमा को मिला के, मोस्ट, एमएसटी। I wrote this mnemonic because the very important thing is from mesothelioma, not meningioma, this is from mesothelioma, till papillary cancer of thyroid here. It means from our mnemonic, that is most, and this M represents mesothelioma. That is mesothelioma. Mesothelioma means pleural cavity cancer. ठीक है? From this most, this is very significantly important because the bodies seen here are known as somova bodies. ये याद रखने के लिए, somova bodies are always seen in most. ठीक है? most क्या होता है? mesothelioma, papillary ovary cancer, and as for papillary cancer of salivary gland and papillary cancer of thyroid. तो P somova का स्पेलिंग ये होता है, P somova bodies are seen in
Mesothelioma.
seen in most में सारा आ जाता है। ठीक है? So that's the end of our topic, and if you have any queries you can comment, and as soon as possible I will answer your questions, and please like, subscribe this video so that we can make new videos for you, and that's the end. Thanks. Thank you guys for having such a great patience to watch my videos. Please do like, subscribe, and press the bell icon to get the latest notifications, and please support us so that we can post such videos further on. Thank you.